So good morning, everybody. Great to see so many people have joined the webinar this morning. Some of you will know me already from previous MyMind webinars. For those of you who are new to the MyMind world, my name is Grania O'Rourke and I'm Head of Communications at MyMind, and I'm delighted to be involved in this webinar this morning. So as was advertised on our various social media channels, this coming Sunday is World Mental Health Day. And as laid down by the World Mental Health Federation, the theme for this year's World Mental Health Day is mental health in an unequal world. So we decided to tackle that a little bit in the context of demystifying mental health, because there's still such a lot of stigma and misinformation and all kinds of other things attached to it. And we'd like to cover off some of that this morning. For those of you who are new to webinars, we have we've started using Zoom now. We were using Microsoft Teams, so hopefully that has made it easier for people to join. But because it's a webinar, you don't have access to your camera or your microphone, but we are encouraging people to interact with the topic using the Q&A function, because we will be having a short Q&A session at the end of the presentation, and we really would like you to get involved in that. And I'm sure that my colleague Vincent, who will be coming up shortly, will have lots of interesting things to say that will pique your interest and get you thinking. The other thing is that the event is being recorded. You will have been notified of that as you joined the call, and we will be making a slightly edited version. So all that little chit chat at the start will be gone when it appears on YouTube at some point next week. And you will receive an email either via Eventbrite or on Zoom, letting you know that it is live on YouTube and with the link to view it. So, you know, even if you are here today, there might be little bits and pieces that you want to go back over, etc. And Vincent has outlined a lot of the supports that are available to help us with our mental health. So they will all be on the slides and able to be viewed on YouTube. And I think that covers it for the moment. If, as we're going through the presentation, any questions occur to you, please do put them into the Q&A function, and I will be covering them off at the end. And I think now, without further ado, I'm going to hand over to my wonderful colleague, Vincent Ryan. He is one of MyMind's therapists, and some of you may have attended some of the previous webinars he did. And if you did, then you know how good he is. So hard act to follow now, Vincent, but there you go. Good morning, and I'm handing over to you.
Thank you so much, Grania. You're too kind. And it's wonderful to have everyone here, and I'll do my best to bring us through this topic today. So you're all very, very welcome. And as Grania was saying, please do, you know, share your thoughts, your questions in the comment section. So I'm just going to open up the slides now. So this is our topic today in light of, you know, World Mental Health Day on Sunday. So we're thinking about demystifying mental health in an unequal world. So this is the overview of what we're looking at today. So we're thinking about what are the barriers to mental health in Ireland, and what are our sources of support and help. So we're going to look at the current situation, a little bit of history, and then looking forward. And then we've got the Q&A at the end. So please do stick around for that. So barriers to mental health. So there are many fears that can really get in the way of us looking after ourselves, getting support, you know, trying to do something to help ourselves. So historically, you know, we've got the fear of the asylum. Like, we have the history of, you know, mental health institutions that, you know, did their best, but often there was like a lot of ignorance, people going and trying to, you know, recover, but sometimes being stuck in systems that, you know, were just kind of not really able to give people the kind of support that they needed. So, you know, that can be a kind of a cultural, a collective history and memory that we can have that can create a fear around mental health. Thankfully, now things are changing all the time. You know, we're getting much more better treatments, and we're able to talk about things in a way that we weren't in the past. And that's, you know, there's some really good trends there. Fear of rejection by other people, maybe seeing other people like, you know, finding it hard to talk, and ourselves learning that, you know, maybe growing up, okay, you're not supposed to talk about this, this is shameful, this is wrong, you know, that maybe I'll be judged. This fear of being rejected can make somebody, you know, not seek the help or support that they need. So we need to be mindful of that fear and address that fear. And that today is about that. Then the fear of being broken or defective is important, because if we feel like that we're fundamentally broken, then there can be a sense of hopelessness. It's like nothing's going to change. This is just the way I am. I should just try and hide this. So being able to recognize that, no, you're not broken. You know, you've had your experience and there are difficulties, and that you can, you know, learn about yourself and take care of yourself better and connect to others as a person, as a human being, is really what we're talking about here. And this kind of passive attitude we sometimes come across is like, this too shall pass, just kind of ignoring a depression or anxiety that's dragging on, or a level of stress that's really not healthy. It's really not good for us. So being active and being able to kind of move forward to get the help to look after ourselves is really important. So now, barriers to mental health are also to do with kind of these kind of inequalities that we're looking at this week. So economic inequalities, you know, not having money or, you know, access to, you know, to funds to pay for services can be a real barrier to mental health. Maybe having economic access to, like, you know, kind of being able to participate fully in society in different ways can, you know, impact a person's mental health. So all the more reason that somebody, you know, would be able to access free or affordable services. Social and cultural inequalities can be to do with your, you know, your community or your family, where there's kind of a story around, you know, you should hide that, you shouldn't talk about that, you know, that's shameful. These can be real barriers to somebody being able to look after themselves, think about what they need, what's good for them. And knowledge inequalities is huge. Like, you might have a very supportive family who love you and want to help you, and there might be money, but if you don't know where to go to get help when you need it, then that can be a real barrier to getting help and support when you need it. So this is the good news. I really want to reiterate that, you know, there's a lot going right as well here. So recovery from mental health setbacks and problems is real and possible. It happens all the time. I work in MyMind, and the therapists in MyMind, you know, we see this every day. We see people recovering, doing well, you know, making sense of their difficulties and looking after themselves and each other better. So that's the good news. But this does often involve seeking support and getting the right help and timely help, not to ignore the problem. Now, this is important that me and Grania have talked about, that there's a range of mental health difficulties that we need to bear in mind. That somebody who's stressed at work and isn't sleeping well is very different from somebody who maybe is, like, you know, feeling really actively suicidal. And then there's lots of people in between who may be chronically really suffering, really anxious or depressed. So, you know, different people have just as different physical health problems. The different range of mental health problems really makes a difference. Like, there's eating disorders that can be very, very damaging to a person, you know, and it can be chronic problems, you know. So, you know, we just need to bear that in mind, that, you know, when we're thinking about the services and supports, that it really does matter what's going on for the person. So now we're going to do a little poll where we're going to ask everybody to participate. So I'm going to ask, in a moment, I'm going to ask Grania to pop up the poll, but I might just read through it very quickly here first. So if you think about, if you today here think about it, if I felt depressed, I would, what would you tend to do? Maybe in the past, or if you think about it now, would you visit your GP? Would you be more inclined to talk to a friend or someone in your family? Would you go and try to find a therapist, counselor, psychotherapist? Would you start looking online, you know, maybe using Google or YouTube or something like that? Or would you be inclined to just manage by yourself in some way? Just decide, I'm just going to tough this out and manage by myself. So maybe Grania, I'll hand over to you for the poll now, please.
Okay, thanks very much, Vincent. Now, just before we do that, I think some people were having difficulty seeing the slides. So if you're still in that position, just put that in the chat function, and we'll see if there's something that we can do about it. This is our first time doing this on Zoom, so there's bound to be little teething problems, so do please bear with us. Anyway, I'm going to launch this poll now, which Vincent has already read out, and we'd really appreciate it if you would take a moment or so to vote. So just to remind people, assuming that everybody can see it, which you can, I'm seeing all the numbers coming in. So the first option is visit my GP. Second is talk to my family or friends. Next one is seek out a therapist. Last one is look online for information. And the very final one is to do nothing. So lots of people answering there. And let me just see now. So I think most people that are going to answer have answered. Oh no, there's a couple more coming in. This is marvelous technology, I have to say, the way you can see. It must be very exciting to be behind the scenes at the Eurovision when you see all these numbers moving up and down.
Yeah.
So I think we've probably got most people now who are going to participate have. So I'm just going to end the poll now and just share the results with everybody. So Vincent, I think you should be able to see those results now as well.
Yeah.
And as you can see, I'm very pleased to see that the smallest number is the people who would do nothing. So that's terrific. And I'm sure that number would have been a lot bigger back in the day. So talking to family or friends is the most popular option, and seeking out a therapist is the next most popular option. So again, I'm very pleased to see that, because it means that people are more aware of the help and support that's available to them, and that therapy is something that will be helpful to them. So that is terrific, and thanks to everybody for participating. So Vincent, I'll stop sharing that now and back over to you.
Thanks so much, Grania, and thank you everyone for participating. And like, I would echo what Grania just said there. That's really encouraging that, you know, people are opening up to their family and friends, and they do seek a therapist when they feel they need that. So, and that low number for doing nothing is really good. That's really wonderful that, you know, that we're seeing that. So good stuff. So now we'll go back to the slides here. And so we're going to think about some disadvantaged groups. So like, this is not an exhaustive list, but, you know, we do kind of recognize that, you know, income does affect what somebody can do in terms of, you know, accessing services, participating. You know, women have historically, you know, been disadvantaged compared to men in terms of employment and salary and promotions, and that's still being rectified in our society. People in minorities, you know, coming to Ireland from other countries, I'm particularly thinking here of people in direct provision, and sometimes the suffering there of having very little resources and being very trapped, maybe very little, maybe in a remote area, really is a group that we need to think about. The traveling community, historically very discriminated against in Ireland, still are, and, you know, very important to remember that, you know, this group are supported in accessing mental health services. People, anyone with a disability, whether it's a physical disability or a psychological disability, you know, that, you know, sometimes that's harder to get access to services to kind of, you know, to actually, you know, have a good income and so on. Disability income is quite small. You think about this group as well. LGBTQ community, very important that, you know, that group has been discriminated against hugely in the past. There's been some very positive developments there. I'm thinking marriage equality and stuff like that, but there's still more to do. And then geography and access technology is huge as well. You know, if you think about the pandemic, being in a remote area without broadband, very, very, you know, disadvantaged in that sense. You know, I think I was saying this to you, Grania, earlier today, like, there's a big difference between someone living in a small rural village in Ireland who doesn't have broadband and somebody who's living in a big city who might be able to, you know, access broadband in a local library or at home. Okay, so this is just a little bit of a plug here for the National Travelers Mental Health Day. So this is happening tomorrow. It's happening around the country. There's some local events being planned. It's happening on the back of Traveller Pride Week. And there's some nice events happening around Cork. I know there's one happening in Mahon tomorrow at 10:45 that I'm very much looking forward to going along to. So if anyone's interested, please do look online and check out what's happening in your area. So this is just a very simple slide. I wanted to kind of like maybe kind of focus our minds a little bit. And it's really simple around something around knowledge. Like I was saying, like lack of knowledge is a kind of inequality, or it's a kind of a barrier. So if we're making decisions based on like feelings of fear and shame, or if we're basing our decisions based on like inaccurate, kind of old information or lack of information, our outcomes are just not going to be that great, probably, you know. And then, you know, in terms of like, you know, kind of how we think about, you know, better outcomes, then we need to kind of have better knowledge. Like if you're going to sell a house, or if you're going to buy a car or something like that, you'd want to know a bit about it first before you go and do that. You'd want to do a bit of research. You want to go to college or something. So the more you know, the more you're likely to get what you need. So that's something really important to remember. So this is a HSC resource page I found recently that I think is really well worth checking out. If anyone wants to take a screen capture of that now, it will also be in the YouTube version of this talk. So, but this is a very good web page, and I don't have time to go through it all today, but there's a great list of supports here that have been put together in light of COVID-19. And it's not just relevant to the pandemic and after the pandemic, it's kind of really good comprehensive list of supports, groups, online therapy, different kinds of websites and so on that people can look into. And I really highly recommend checking out that web page, but not now. Stay with the talk. Don't go there yet. Okay, so this is like a nice rhetorical question I'd like to put to everybody. So, you know, sometimes we encounter somebody and they're saying something to us that sounds concerning, like they might be using language like, I don't know how I can go on, or I really can't see any way out of this, right? And this kind of language can be very upsetting for us to hear. So I'd like you all to think about this now for a moment. So this is in light of, we had a wonderful talk by Alan Farrell from Pieta in June that MyMind was sponsoring, and Alan addressed this question. So we have somebody who's already talked about this from Pieta. So just maybe take a moment to reflect on this. So if somebody you knew was hinting at something around ending things, or, you know, self-harming or something like that, what would you be inclined to do? Would you be inclined to ask them, is everything really okay? Like, you know, it sounds like, you know, you sound very upset. You know, just, you know, what's really going on? Would you try to cheer them up? Would you try to, you know, remind them of something happy that happened, or remind them about, look on the bright side? Or would you be kind of just really uncomfortable and just not know what to do? Would you try to change the subject? Just think about that for a second, everyone. It's not an easy question if we do meet somebody in this situation, but just take a moment maybe to think about that. And this is what Alan was saying to us, that, like, you know, from Pieta, is if somebody is hinting at suicide or self-harm, it's really important that we ask them, is everything really okay? Because we know now from research that, you know, when somebody is really feeling in a dark place, feeling like really hopeless, they can start thinking about what the only solution is to end it. So that they have a real problem, and they feel like there's no answer to this problem, and I can't talk about it, and nobody wants to hear this, and maybe the only solution is to get out, to end the pain, so to speak. So it's really important then to kind of go towards the person where they are and say, you know, I really hear you're in a lot of pain, or it sounds like you're really upset. Can you tell me about what's going on? This is a lifesaver, you know, so we need to kind of think about that. There are times to cheer someone up, right? There are times to remind somebody, look, you know, weekends around the corner, whatever. But there are other times when it's important to really check in with somebody. Okay, so we're going to look at the list of sort of supports that are available in, you know, for us all in Ireland today, and the categories of those supports, and like what's naturally there for us anyway, and then what are we developing and what's available. So here's the list. You can read it there: personal resources, family, friends and work colleagues, wider community, GPs, nurses, teachers, Gardaí, supportive groups, phone, text and online services, and affordable therapy. So there's quite a bit here. So I'm going to try to move us through this, and, you know, we'll get to the questions and answers, but let's have a look at these in order. So personal resources is kind of individual things that an individual finds, you know, gives them a boost, kind of, you know, really makes life worth living. So we're talking about hobbies, pastimes, interests, what people do, you know, that really kind of make them who they are. So it could be like, they might, reading a good novel, following a really good TV show, Netflix or whatever. Following sports, I know it's huge for many, many people. When the hurling starts, or the rugby, it's just passion. It's that's real. It's real living to really be involved in that, interested in that. So podcasts can be really important, particularly I think when a person's down, having a nice podcast to listen to, something to take them out of that that stuck place. Very individual, but this is a huge part of our mental health, and it connects us to other people as well. So obviously family, friends, and work colleagues are a huge part of this. So like, being able to check in with each other and say, look, how you doing? Are you're all right? Like, what's going on? To really kind of give that kind of signal to their person that it's safe to talk about themselves, and not kind of dress it up always and be like everything's fine. And to respect each other's individual lived experience. So for example, just because I don't know what it's like to feel that way, that I respect that that's what that person has experienced, and that's real for them. The wider community is really important. We need legislation to protect our safety and our well-being. For example, like right to switch off is really important now with mobile phones and technology. We can go home and have a break from work and college and what's going on. All the work legislation, all the disability legislation, equality legislation, all really important for our mental health. Information campaigns are also very important. Like we've had to kind of re-educate ourselves about mental health as a community over the years. So for example, now PIETA have this this very, very important campaign, Know the Signs, to kind of be mindful of what might be a person who's really in distress, so that we recognize it and we're able to meet that person in that place. Media discourse and social media is a huge part of our mental health, both for good and for ill. So like, we can get a lot of support online. We can kind of find, what's going on through Facebook and YouTube and other social media connections, WhatsApp groups and so forth. But also social media can be excluding, it can be, it can be distressing stuff there, we can get pulled in to kind of like, overly using social media. So we do need to mind ourselves and each other when it comes to social media, that it's our friend and an ally, and not, kind of draining us of good energy. I just want to say a little bit about GPs, nurses, and teachers and Gardaí. Often these people encounter members of the public, us, who are in moments of crisis or distress, right? Particularly GPs, like I was saying to Grania there before, that for every one client I'll see, my local GP will see multiple, because somebody will come into their GP and they'll be feeling depressed or anxious, and they might not be ready to seek other help, but they'll say it to their GP because of the level of trust that's just there. So we need to really remember our GPs, nurses, teachers, and Gardaí, that they have such an important role in helping us stay well in our society. So now we're thinking about supportive groups. So like Aware is a wonderful group that runs Aware is a wonderful organization that runs groups. These are free groups for people who struggle with depression and bipolar. And anyone can, seek out Aware groups, join one. These are facilitated by facilitators who, keep the atmosphere safe and constructive. And it's a place where somebody can find, like others who are struggling, and get help and support. AA, the Alcoholics Anonymous, and AlAnon, these organizations, sister organizations, really help people who've been affected by addiction, and people who have been in the families of where there's been somebody affected by addiction. And these groups are they're just throughout the country. They're in many local towns and villages. Really, really wonderful source of support and solidarity. And you can go along to a group, see if it's right for you. There might be, you might be the one that you want. There might be another local one. You don't have to go to the one that's just down the road. I know sometimes it's about finding the right group, and that's important, whether it's Alcoholics Anonymous or Al-Anon for the families, or there's a number of other kind of offshoots from that. Then just to say a little bit about HSC therapy groups. So the HSC do run really important treatment groups, therapy groups based on CBT and things like DBT for, kind of like difficult kind of thoughts, ruminative thoughts that can be quite depressing, anxiety provoking, but also that kind of emotional overwhelm. And, for somebody who's really struggling with really difficult emotions, DBT, dialectical behavior therapy, is very, very effective. Group type of therapy, can be individual as well, but group therapy that anyone who's watching who knows somebody or who might struggle with that could look into. And then finally, Open Dialogue Ireland here in terms of groups is a very collaborative way that somebody who's recovering from maybe a mental break, or maybe an episode of psychosis, can actually go and meet their psychiatrist and their clinical psychologist, and actually have a kind of much more collaborative experience of rather than the diagnosis of this is just what's wrong with you. It's kind of more like, let's explore together what your experience is and your experience in among your family and friends. And it's a really nice initiative that's been going on now for a few years. It's particularly active, I think, in parts of Cork, West Cork and Kerry. And for anyone who's interested, it's really really well worth checking out. This is really important as well. Like there's phone, text, and online services that are available to everybody free of charge, and many of these are 24/7. So to begin with, the Samaritans are amazing. They do incredible work. They're there for everybody. They're on the other end of the line. It's free. It's 24/7. And if for someone who's in a really dark place, who really needs to talk to somebody to kind of get through that moment, that difficult moment, the Samaritans are amazing, and I can't say enough good about them. I should mention I left out Pieta. They should be here in this list. They do offer a phone and text service as well for people who are really struggling. Childline for our younger people in our community, doing wonderful work as well as a phone service. Then this text 5088. I won't pronounce that right, Grania, 5088, I think. So that's a really, really good. It's been developed by Spun Out and funded by the HSC, and it's primarily targeted at our younger people, students and younger people, but it's for anyone who wants to access support through texts, and just text in, say I need some help or whatever, and you'll be able to link in with somebody and they're able to check out what's going on for you. And then finally, in this list, the Good Limbo are a wonderful organization that we've done some work with before. Grania and myself have worked with Mirren on a former webinar that's now available on YouTube. There's many MyMind webinars in the MyMind channel on YouTube, and you can watch back that. We covered identifying emotions there a few months ago, and Mirren was able to tell us about what the Good Limbo are doing. They have a website and they have a platform, and anyone who wants to go along and join that and get into discussions, talk about what's going on for them, get support from other people. It's really, really nice service, well worth checking out. So we're coming towards the end here now. There's only a couple of slides left, but we'll just look now at free and affordable therapy. So first of all, our National Health Service, the HSC, they do offer free counselling and psychotherapy. Usually you access through your GP. So your GP would refer you in for an assessment with the HSC primary care centre that's local to you. And then if you're deemed like, kind of somebody who needs it, you would be offered counseling or counseling and psychotherapy. The trouble here, I suppose, is there's often waiting lists, but it is there. You don't have to have a medical card. Anyone can access this. But that is something to really think about. And there's a lot of good work happening there, obviously, all the time. And I did spend some time working in the HSC when I was training, so I know about what amazing stuff's happening there. But MyMind, of course, with the pandemic and COVID, MyMind has had to really, really kind of pick up where the HSC maybe couldn't expand fast enough, and we've gotten a lot of HSC funding here at MyMind to provide some free counselling, up to 12 sessions for people who are really struggling with COVID and the pandemic. So this is a program that's running till the end of the year. It's called the COVID Project in MyMind. And MyMind will be able to offer somebody who qualifies up to 12 sessions of free counseling or psychotherapy, and then that can be obviously extended in certain circumstances. There might be a fee then. But in a broader sense, MyMind offer low-cost counseling or counseling that's kind of relevant to the person's income. So for somebody who's unemployed or a student, the fee is €20, part-time it's 30. And then for somebody who's who's in full employment, it's 50. So MyMind has really kind of gone into that space where it's like, it's affordable. Like whatever your level of income is, this is what we're trying to do here in MyMind, is kind of meet you there, and make something affordable for you. So that's MyMind. As I said, that project still running till the end of the year, the COVID project. So if you do feel like you might qualify, give MyMind a call, give us a call, and you know, you'll be able to find out if you'd be able to get some free sessions till the end of the year. So there are other social enterprises like Cushcame. That's just one. There's many around the country that do offer low-cost counselling. So what you do there is you contact Cushcame, and they just get to know you a bit, see what you're able to afford, and they might be able to pair you up with a therapist. And I do some work with Cushcame, so it's a really good service in Munster in particular. Excuse me. Pieta offers free counselling for people who are at risk of suicide and self-harm. So in a case where that's what the person is struggling with, it's good to get in touch with Pieta and try to get paired up with a therapist there. You just ring them and make contact that way. And then finally, counselling training courses. So around the country, around Ireland, there are colleges which train counsellors and psychotherapists. Every year there's graduates coming through, and every one of those trainees look to work with clients. And usually this is very low cost or free. So if anyone here would like to work with a trainee therapist, I actually highly recommend it. I did my training just a few years ago, and some of the work is really good, like, because the trainees are very, very fresh. They often have a lot of support from the college, from supervision. They might have a lot of clients, so you'd be getting a lot of attention from that trainee. So well worth considering if you wanted to work with a trainee therapist, depending on your circumstances. You could contact either a local counseling training college or the IACP or the IAHIP, and just give them a ring or email them, and they'll be able to direct you. So we're near the end of the webinar part. We'll be turning to questions and answers soon. So I just kind of want to say a little bit about maybe where we need to do more as a society, in my opinion, having seen the landscape of mental health in Ireland. So in my opinion, the long shadow of attachment problems and problems and developmental problems can lead to interpersonal and personality suffering. So, having a difficult childhood, we know that developmental trauma, the ACEs study, that these things really can impact a person for many, many years. And so to be aware that sometimes, a few sessions of counseling might help a person get through, a dark moment, but often it's more longer term and specialized counseling, psychotherapy treatment that is really what's needed. So even though there's a lot there, I think we need more provision of this kind of service in Ireland. I just say here, it can take time to gradually repair trust and find one's place in the world when there's been early trauma and early attachment wounding. So here's my last slide. What's the point? What's the point for today? We all have a part to play in shaping the conversation about mental health in Ireland. Sources of help and support are out there. They really are, but you may have to really seek it out. You may have to really educate yourself. You may need to get the knowledge to find out and talk to others, find out what's going to really help you and help your family and friends. So the real takeaway today I'd like to suggest is don't give up, and knowledge is power. And I know that's been a lot of information. We've gone through a lot there. So I'm going to hand back now to Grania. Thank you very much. And let's see if we've got some questions and answers, or questions anyone. I'll try to do some answers.
Thanks a million, Vincent. That was terrific. Would you mind stopping your share slide? And then I'm not sure if everybody can see both Vincent and myself. So just to clarify a couple of things, we've a couple of people on, one from Barbados and one from Australia. So I had to clarify what the Gardaí was. So for anybody else who's confused about that, that is the police. And Gardaí is an Irish word. It means guardian, effectively. I've just got a comment in here from Mary Mulcahy to everybody. So hopefully everybody can see this in the chat. So there's also 85 family resource centres, and obviously we neglected to mention those, Vincent, actually, and they deliver free or low cost therapy all over the country. And there's a link there in the chat for anybody who wants to pull that up. So one of the key things that we were anxious to do today is just to make sure that, you know, there has been so much focus on mental health, particularly because of COVID. It has thrown up all kinds of spotlights on the mental health challenges that many of us have seen, but it has also thrown up the challenges that Vincent alluded to at the start, where there's a very broad spectrum of poor mental health leading all the way to mental illness. But the point of our webinar today is really about trying to instill some hope in people. One of the things that Alan said when he did the suicide prevention webinar with us, which I was really struck by, is that nobody wants to die. They just want the pain to end. And I was really, really very struck by that, because when you stop and think about it, if you could offer somebody who was feeling suicidal a choice and say, look, we can end this pain for you, would they actually go ahead? And the answer is that they probably wouldn't. So just to be mindful of that. So one of the questions from one of our attendees, Vincent, and again, apologies, I'm not sure if people can see this on the screen. Can you see this, Vincent?
I can, yes, Grania.
Yeah. So is EMDR psychotherapy available at low cost or by undergraduate students, please? I've happily resolved long-term grief and anxiety thanks to EMDR, and thanks for a wonderful webinar. And that's from Anonymous. And we thank you very much for that. So we're going to answer that live, Vincent. Hopefully you have the answer to that.
I do. I'll do my best. So thank you viewer for that question. So EMDR is generally a kind of a post-training specialization. So student therapists generally won't be trained in EMDR. It's something that somebody does after. Now, is it available at low cost? The short answer is yes. Now, I don't know exactly where that would be, but many therapists are trained in EMDR, and many therapists work through low-cost services. I'm sure, I mean, I'd be surprised if there weren't therapists in MyMind who would be trained in EMDR. I don't know. I myself am not yet. It is a very effective treatment for many forms of trauma. I would say it's not the only treatment for trauma, but it is a very effective one. And you know, I suppose it's kind of like what I said in the webinar. Sometimes if you're looking for something very specific, you kind of have to really seek it out. And in terms of finding it at low cost, I mean, yeah, I mean, there will be different services that will have somebody who's trained in that, but it might take a little bit of research and you know, kind of finding your way to the right person. That's how I kind of answer that.
That's great, Vincent. Thanks a million for that. And just to say also that, as you mentioned, trauma, our next webinar, which will be the last in the current series, is taking place on the 11th of November, which is a Thursday. And we're actually dealing with the topic of trauma. So that was a very good segue into that. So thank you for that question. Nick from Smarmore has just put something in the chat to say, thanks, Vincent Ryan, for another very informative webinar. And Nick is involved with Smarmore Castle Clinic. They're based up in near RD in County Louth. And we did a webinar with them early in the year covering the topic of addiction, which is a very serious issue in lots of countries and no differently in Ireland. And, you know, Irish people, it would be fair to say, generally speaking, have a very interesting approach to alcohol consumption, and we have very interesting attitudes to drinking, which are not always very conducive to good mental health. And Nick is making that point here where he says we often find that people end up medicating and numbing mental health challenges with alcohol or drugs to cope, and then they end up with the additional problem of addiction. So it becomes this really difficult cycle to get out of. So thank you very much for that, Nick, and thank you for all your support for our webinars. So we've no other questions at the moment. So I'm assuming that what we presented this morning was comprehensive. As I said, one of the key issues that we were trying to address this morning is, in spite of the inequities that have been shown to exist, particularly through COVID, there are a lot of supports out there. Many of them are free. And one of the big issues, I think, for a lot of people is making that first step to ask for help. And I think that is the key thing, that if somebody is struggling, or if somebody is in your family is struggling, to ask them, would they like some help? I know, for example, a woman that I know, her friend was struggling quite a bit, and my friend asked her straight out. She said, you know, are you feeling suicidal? Are you feeling like you could harm yourself? And they ended up having a fantastic conversation around the topic, and her friend subsequently thanked her for having the courage to ask that question. Because, as Vincent has alluded to in the presentation, there's no question about it, it's difficult and it can be very tricky, and you don't want to make things worse. But as Alan from Pieta said, in his experience, and he's an expert in that field of suicide prevention, the chances of you making things worse are very, very, very small. So Vincent, have you anything to add while we're waiting for anybody to pop another question into the box?
No, I think those comments and questions are great. I think, you know, Mary there highlighting the 85 family resource centers is really thanks, Mary, for highlighting that. And one of the things I suppose is that, you know, me and Grania were talking about this. If we were actually to go through all the services and all the supports are out there, you know, this would be a very, very long webinar, you know, so, you know, we haven't even covered everything. So like that, this is not a comprehensive list, but it's to kind of give people maybe here today ideas about where to look and what, like, you know, some broad ideas about what's available, and there's more. So it's, you know, I'd like to think that this is even though there are challenges, and there are certainly, you know, a lot of mental health issues now coming out of COVID and so on, I'd like this to be hopefully on balance a positive story today. What do you think, Grania?
Absolutely, yeah. And in fact, one of the things we were talking about earlier is AlAnon, and that's for families and friends, people in the broader circle of an alcoholic. And you know, I have some experience of that myself. And one of the great things about AlAnon is that it really puts the focus onto the person who's seeking the support, rather than going to the groups and giving out about the person who has the drink problem or the alcoholic in your life, because that's part of the challenge, I think, that we face in modern society. And Vincent also mentioned earlier on that social media can be very helpful, but of course we also know that it can be quite a hindrance, because there's a lot of negativity, and it can be very, very easy to get sucked into that negativity. And at the end of the day, what we in MyMind and other organizations like ourselves are all about is trying to move us away from that negativity and into the positive space. Because, you know, the Beatles often come to mind in this regard. No man is an island. So none of us can do this by ourselves. That has been my own personal experience. I need the help of support networks around me. And again, the point we're trying to make today is that those support networks exist. So Vincent, while we were chatting there, an anonymous attendee wonders, what are our thoughts on counselling people in crisis? Someone perhaps who is experiencing homelessness or who is in active addiction. So would you be kind enough to take that?
Yeah, of course. So I'm just going to have another look at that question if I can. So what are your thoughts on counseling people in crisis, someone experiencing homelessness or an active addiction? Yeah, I mean, this is really, the hard edge of mental health, because somebody who's homeless, like, that's such a distressing situation to be in. And I have worked with a couple of people who've really struggled with homelessness, and kind of getting the basics in place can often be a really important step. So to help somebody to access, social housing, I find sometimes it's real practical stuff, can be really, really key to get the person into a place of safety. Having like a roof over their head, a door they can close and turn the key, can then create the conditions to really get into more therapeutic work, more, where the person starts to look at, okay, now I've got some basics here in place. The crisis part needs to be addressed first before real counseling can happen. And I suppose that we also see that with, addiction and suicide, that it's really about how do we help the person to stabilize and to kind of have enough support that they can begin to, as you say, Grania, look at themselves, look at like, how do I take care of myself? How do I take back more responsibility than I've been able to do? So there is that kind of like, first step. So same thing, I mean, yeah, so yeah, that's kind of the counseling is sometimes practical. Sometimes I think the counseling can be about like, what can you actively do this week to not drink, to stay sober, or to minimize that. Like, what kind of steps can you take? And that creates that kind of safety and stability. The person can start to, develop more, more insight perhaps into what they need to change, or what they need to kind of make their peace with, to kind of move forward in life.
And if I could add to that, we have a couple more questions now, but before we get to those, I know, because of my experience with AlAnon, that sometimes the challenge with somebody who is in active addiction is that it's about willingness. And if that person is not really willing to become sober or to become clean, that's the first barrier really that has to be gotten over. And that's where a therapist can help in that situation. And then sometimes there are, such as Smarmore Castle Clinic, which I mentioned earlier on, residential treatment centres where somebody who's in active addiction might be able to go to, and it's a very safe space, and you're away from the substance, whether it's alcohol or food or drugs or whatever it happens to be. And some people can find that very helpful. So again, coming back to something Vincent said earlier on, it's not a one size fits all solution, but the solutions are there if people are willing to look for them. So Mairead, thank you for this comment. There are many resources available to address mental health issues, but she feels that one of the barriers for those suffering is the element of shame. And Vincent and I were in fact talking about this only last week. So for good friends and family to ask the difficult question, are you okay, can be the first step for the person suffering to open up, because that idea of, thank you for that, Mairead, the idea that, if it's a family member or a friend, there's going to be a level of trust there that if the shame is very strong, they might be able to answer it honestly and open up honestly. Anonymous attendee has asked us about people from ethnic minorities who are not fully aware, and we mentioned this, I think you talked about direct provision earlier on, and the migrant community. They're not fully aware of how to access mental health services, and what have we got in place to raise awareness in such groups, especially issues around stigma. So I might answer that for a moment, Vincent, and just say that there is a website which is part of the HSC mental health offering called yourmentalhealth.ie, and it has a whole list of services all over the country for people who are dealing with different types of mental health challenges. So that would be where I would send somebody as a starting point. There's also the Immigrant Council of Ireland. if the immigrant has not been in touch, the migrant has not been in touch with them already, they're a very good organization, and they offer a lot of supports and a lot of help. And there's also the Migrant Council. So there are a number of groups in Ireland which specialize in helping people from migrant and ethnic minority communities. And again, Google is a great man for looking up these things. And generally speaking, these organizations are charitable organizations, and a lot of their services are free to the end user. And that's a really good place to get some help. Vincent, have you anything you'd like to add to that?
Well, no, I think you've covered that really well, Grania, and they're very good resources to access. Cushcame, the organization I mentioned earlier, that's based in Munster, they do work with people in direct provision, and you know, they have a program around that at the moment. So if anyone would like to contact Cushcame around that, you know, you can find out more from them. They have some counselors who are really trying to meet people who are coming back from often very traumatic situations, and actually kind of know how to, you know, to work with somebody who's really struggling with that kind of situation. And it's a kind of strengths-based approach, you know, where it's really like, you know, helping the person to tap in to what's really helping them to get through what they're going through. Because often they come from a very difficult situation, and then they arrive in Ireland, you know, we're talking about direct provision here, and it's often like a sense of helplessness and kind of dislocation, and, you know, the culture is strange. So there's an awful lot of work that needs to be done there for sure. Yeah.
Excellent. So Liam Brazil has said, thanks, Grania, Vincent. So thank you very much, Liam. I'm imagining you probably had to pop off. It's great to get the level of interest, Vincent, that we have in these webinars, because I'm very conscious as one person how busy everybody is and how many of these webinars there are, and most of them are free of charge. And so, you know, it can be very attractive to sign up for something and then, oh gosh, I haven't time to attend, etc. So that's why it's really useful from our perspective that the video will be available next week. So if it was a thing that you had to leave early and you missed some of the Q&A, etc., it will be available, as I say, on YouTube. And also just to remind people again, our next webinar is on Thursday, the 11th of November, and we'll be dealing with trauma, and one of our psychologists, Lottie Lenars, will be talking about that topic. It's one of her specialist areas. So Vincent, as we have, oh sorry, we've somebody, well, we're saying El Krista Cedras, I'm probably pronouncing that completely wrong, so apologies. Thank you for the informative session. You're more than welcome. We're delighted to be of help, and that's what we're here for. And if we can have any message, it is please, please, please don't be on your own with these struggles. Do reach out for help. The help is available. A lot of it is free, some of it is low cost, and you know, please do avail of it. So Vincent, as we haven't any other questions, I think we'll finish up there. And again, I'd like to thank everybody for joining us today. You know already about the recording, and we're getting some very nice thank yous in there from Eileen and other people. So we appreciate that. And so until we see you the next time, which would hopefully be on the 11th of November, please do look after yourselves and look after each other. Thanks very much indeed.